Hi, my name is Monique Salazar. I'm a fourth-year medical student at the University of Queensland Ochsner Clinical School, and I'm here with Dr. Anna Suessman, our Pediatric Clerkship Director, and we're going to be talking today about one of our international elective opportunities, Floating Doctors in Panama. Can you tell me a little bit about it?
Yeah, so I'm really excited to partner with UQ-Ochsner Clinical School and take with me some students who are interested in doing global healthcare. This organization I have worked with since 2012. They are an NGO, so a non-for-profit organization that voyages across islands off the coast of Bocas del Toro, small expat kind of island that has about more than 20 islands off the coast, and these islands are inhabited by indigenous villagers and persons that have no access. No access both because of the rugged terrain, the expense of travel, and interestingly enough, the Panamanian government provides healthcare, socialized medicine to its people, but if you can't get off your island to make it to mainland hospitals, you don't get medical care. You don't have preventable diseases prevented. And as a pediatric emergency medicine physician, the children that I meet during my trips to Panama with floating doctors, they leave an imprint every single time. They are the most, all the people, all ages, are the most grateful individuals for what we do and when we visit. The amazing part of Floating Doctors, it's a sustainable program. So the boats will arrive every 3 months, the same island. It's on a schedule. We're never off schedule. They come with medications that last the individuals for 3 months at a time. And the clinics run from 8 a.m. to 10 p.m. as long as it doesn't get too dark, inside of a school. We arrive to the island on a dugout canoe. It's actually a dugout tree made into a canoe. Get a little soaked on your way there, but when you get there, you dry off, throw on a pair of scrubs, and you start triaging. The line for us starts the night before. People travel by foot, some of them 3 or 4 days. I remember a mom who carried her 2 kids in a bag on her back. Each kid weighed more than 25 pounds. I could barely carry one of my children who weigh that much. And she walked for 28 hours with very seldom breaks to make sure she arrived to the floating doctor outpost where we set up. Patients will wait as long as they need to, as long as they possibly can, and get seen by a physician. There's usually an interpreter. There's usually a nurse or somebody in the role of medical assistant. And you never know what's going to come to you. We have lots of tropical diseases we see, but the normal stuff, right? Uncontrolled hypertension, hyper or hypoglycemia, fractures. I'll never forget a child that ran up to me and showed me their bone coming out of their skin. It happened many months ago. It was, many weeks ago. It was full of bugs and eroded tissue from how long ago the injury occurred, but that child was so happy and moved on past that injury and was so excited for some kind of help that we can provide. And sometimes our help is limited, right? For that child, we had to transport them for elevated care. They needed an OR, clean out, orthopedic intervention, and floating doctors, through volunteer contributions and other financial support, sometimes has to pay for those measures. But anyway, that leads to the excitement. That leads me back to my excitement, because I think as a medical student, it's the most impressionable state in your medical career. And to have this type of exposure makes you feel great, because you provide care, you touch patients, you evaluate and you determine diagnoses, but you also get repurposed, or you, in your mind, the purpose of what you went into medicine for is elevated, I think. I used to do this yearly before I had children, go abroad, provide healthcare, because the appreciation of those who have zero access or limited resources is unparalleled. You can't compare it to a patient that we experience on a day-to-day basis. And you realize what it feels to be privileged to have healthcare in the U.S. And we have our obstacles and challenges, of course, but I'm excited to have 7 students and 3 of my nurses come along and show off our skills as Ochsner Clinical School and Ochsner Health representatives, but most importantly, what it's going to do to each one of us while we're there.
Can you tell me a little bit more, as a medical student, our application process?
Yes. So the opportunity currently stands in the optional elective time period, which is at the end of November through the first couple of weeks of December. Because we're working with another organization, I do open up the applications quite early, so late spring, early summer. It requires a small personal statement as to why this applies to you, what this will give and help you with in your career and also your own interests. And then we have quite a bit of interest this year. I wasn't able to take everyone, unfortunately, but those students must have good standings determined by the UQ-Ochsner Clinical School, and my nurses must be able to have time off. And, once the group is kind of made and built, and it depends on what the space is available, because the floating doctors have a base that hosts us. So we're provided room and board and great food by Panamanians that cook amazing for us. So once we determine our numbers and floating doctors accepts all of us as a group, we buy our tickets. Unfortunately, the students and the nurses who are going are paying out of their pocket. So you do have to have financial abilities to be able to come along. But once we go, or once we buy our tickets, usually that deadline is midsummer. And then by late summer, we start meeting on a monthly or every 2-month basis, hang out as a group, collaborate, decide what tropical diseases we want to learn about. We talk about our packing list. You can't forget the headlamp. You can't forget the hammock, because usually at some point we go on a multi-day clinic, which is you take that dugout tree canoe and you travel 3 to 5 hours by boat. When you arrive, you set up camp at the bottom of people's homes in a not used building, and you set up hammocks. And that is your base for 3 to 4 days. Those purposes of that is it's further to travel. The clinics are much larger, and so we can't see every patient during the day. So we'll live within the community. The benefit of that as a part clinician, part educator is you see patients, but you also run a lot of educational topics with both the community workers at each island and the people, right? So we talk about hand hygiene. We talk about teeth brushing. We exhibit hygiene of teeth for children. Just a few topics. So you do education, you do the patient care, and then at night you hang out with the communities. They are so welcoming. They're so thankful. And you might have a machete or 2 injury to take care of in the middle of the night, because they have to use the machete to make your dinner. But you do really bond, and hopefully those longer experiences are actually what previous groups I've taken. That's one of the main reasons they've returned, because they've made lasting relationships with people in Panama.
Thank you very much, Dr. Suessman. I really appreciate it. As one of the students that will be joining you on this trip, as a native Spanish speaker, I really look forward to it. I know some of our students are going to be practicing their Spanish along the way, as many of them do not speak Spanish, but still are relishing in the opportunity that they have. And we look forward to seeing you guys next time on White Coat Wednesday.
Thanks for having me.